All right, so consider this scenario. You're in the supermarket and a man collapses in the aisle. What do? First of all, you go over to see if he's all right, and you soon find out that he's not breathing and he has no pulse. So you immediately tell someone to call 911 and get an AED and you begin CPR. So 3 things that we're going to cover is compressions and breaths, placement of your hands and the tools that you may use, and the benefits of CPR. So let's begin with our compressions and breaths. So CPR stands for Cardiopulmonary resuscitation. And for an adult, you're going to have 30 compressions to 2 breaths. And you're going to roughly want to go about 2 inches deep so that the heart fully pumps and that your air and oxygen is going through your system. So for a child, it is 15 to 2. So you're going to have 15 compressions to 2 breaths. And you're going to want to make sure that you're not going to go quite as hard on the child. You're still going to go 2 inches deep for a child, but for an infant, it's only going to be 1.5 inches deep. So for placement and tools, you're going to place your hands in between the nipples, so also kind of about the bottom of your sternum, so in the middle of your chest. So there's also tools that we can use, which would be a mouth guard, and you can either have the bag, which you'll normally see in a hospital, or there's actually a mouthpiece that you can use to transfer oxygen. But really the reason why we have the mouth guards is because it helps prevent disease transfers, and also if the patient per se were to come back to life, if they have vomit or other bodily fluids in their mouth, it's not going to go in yours, because that's honestly quite gross. So now we have the benefit of knowing CPR. It's useful everywhere. So like I said, in the supermarket, at a restaurant, in your own home. It could potentially, you yourself could potentially save someone else's life. Even if you're not the one physically doing the CPR, you could tell someone how to and necessarily instruct them on what to do. So for a recap, we went over the compressions and breaths, then we went over placement and tools, and then we went over benefits of CPR. So for a quick demonstration, I'll show you on how to do CPR. And one of the songs that you could potentially think of is Staying Alive, which is what many start to think of. So you would first start by taking their pulse and see if they're breathing. In this case, definitely no pulse, definitely no breathing. So you begin and you go be 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, and so forth. It's a little harder when it's higher on the ground, but higher off the ground. But and also for breath, you would take the mouth guard, tip their head back, and you would place it over, adjust if you need be, and essentially you're going to want to see the chest rise. But yeah, so hopefully the demonstration has somewhat maybe encouraged you to learn CPR and get officially certified, and I really hope that you guys help people stay alive. All right, staying alive. Thanks.